I'm here to talk about Alemtuzumab, or Lemtrada. So Lemtrada is a new treatment for multiple sclerosis, a monoclonal antibody that was approved for use in North America and the United States in 2014, 2015. It's given as an infusion, lasting for 4 hours, once a day for 5 days. So the way it works is it's given as a single pulse over 5 days, and then no further treatment is needed for 12 months. And then patients have another 3 days of therapy, and no more is needed for several years after that. So this is a short, sharp shock to the immune system. The drug kills off T cells and B cells, and then they grow back. Alemtuzumab, or Lemtrada, is a good example of an aggressive therapy for multiple sclerosis. So it's highly effective, and it comes with significant adverse effects. Surprisingly, given that we deplete the immune system with this drug, the most concerning adverse effect is where the immune system grows back and is overactive, causing autoimmunity against the thyroid gland in 1/3 of patients, and against platelets in 1% of patients. Clearly, the safety profile of Alemtuzumab, Lemtrada, means that patients need to comply with quite an intensive regime of monitoring. So although the drug is given infrequently, patients need to have regular blood counts and urine tests to make sure they're not about to develop one of the side effects. Clearly, there's a trade-off here between having such an effective therapy and the dangers that it brings to the patients. And to my mind, this drug is reasonable to take for a patient and a doctor who can conform and comply with the monitoring. As soon as the monitoring breaks down, either because the patient or the doctor have failed to follow the regime, then Alemtuzumab, Lemtrada, becomes a dangerous treatment for multiple sclerosis. So all of our trials restricted recruitment to people within 3 years, 5 years, and then 10 years of disease onset. So we've done two phase 3 trials, which totals some 800 people treated with Alemtuzumab. And what we're here this year to announce is just how effective and how durable that efficacy is. So this is the most effective treatment for multiple sclerosis when given early on in the course of the disease. We see a very common response. So all patients had significant reduction in relapse rate and in the risk of accumulating disability, and in improvement, mean improvement in disability, compared to our control group, which in all of our trials was interferon beta 1a. Depending on where you are in the world, Alemtuzumab, Lemtrada, is available as a first-line therapy for MS or as a second-line therapy. Here in the US, it's available as a second-line therapy. And what I very much hope is that people with MS in the United States are offered this as part of the choice for when their first-line therapies fail. We need to convince neurologists and people with MS that one way of treating this disease is early aggressive therapy. We might call it an induction therapy approach. So taking MS as seriously as some forms of cancer, where at the very earliest signs of the disease you treat with the most aggressive therapy that you have. We think for some people with multiple sclerosis, this is the right way to treat the disease.